An accident and emergency department, an emergency room, emergency ward, or casualty department is a medical treatment facility specializing in emergency medicine. The acute care of patients who present without prior appointment, either by their own means or by that of an ambulance. These facilities can be found in almost every country or state of the world. Here in Guyana, the Accident and Emergency Department of the Georgetown Public Hospital Corporation, GPHC, is said to be one of the busiest places in the city, opened 24 hours a day. It simply never sleeps. And this has been further compounded by the advent of the COVID-19 pandemic.
Hundreds, even thousands of persons have used this entrance behind me on a daily basis. Since COVID-19, that figure has increased tremendously. We're at the Accident and Emergency section of the Georgetown Public Hospital Corporation.
As we check in at this busy emergency section of the country's premier health facility, we meet Dr. Balram Dudnot, Senior Registrar of this department. He gives us a guided tour before we sit down and have a one-on-one about his department, its staff, and daily operations in this COVID-19 pandemic.
This is our main entrance to the Accidents and Emergency Department. Now, as you'd notice just by the right side to the security hut, there is basically like a small screening process where there are healthcare professionals, mostly nurses. They would ask you a few questions, they would take your temperature, they would sanitize you and so on before allowing you into the premises. Now, once you get to the Accidents and Emergency Department, as you come in, we have a triage system that we do, which is a two-phase triage system. We have a primary triage system and we have a secondary triage system. Basically, what the primary triage system does is that there's a nurse and a doctor, and they would ask you certain questions. And because of COVID-19, because of when we look at the signs and symptoms and the complaints that would put you at a higher risk for COVID, we have these two extension facilities in front of the department where we put those patients. Once a patient enters the department, he or she will be approached by a nurse or the triage officer, who is usually one of the senior doctors in the department, because triaging is basically a scale where you're determining the priority of care or the level of care that the patient should get. So upon entering, you're being in contact with one of the nurses or the triage officer, and they make those decisions as to whether, hey, you know what, this patient might be a suspect for COVID, depending on the signs and symptoms, the complaint, the contacts that they would have been in, or the areas that they're coming from, right? And then they make that decision as to which one of the extension units you go to, or whether you're clear and you're deemed less likely to have COVID-19, and then you can come into the department and be seen. Once you've been seen by the triage nurse and the triage officer, and they deem it necessary that you be seen in the Accidents and Emergency Department, then a triage checklist is being done for you. And after that is done with your vital signs and so on, this comes to the registration area, where everything is being recorded, and then this goes back into the department now to have one of the attending doctors call you. And all your documentation is done through this. When the patient is being discharged from the emergency room, then medications are written here. This goes to the pharmacy, they pick up the medications, and then it's being kept back as record. If they're being admitted to the inpatient facility, then this goes along with the next admission form, and then this goes to the ward.
Dr. Dudnot now takes us to the main emergency department.
Once a patient enters these doors here, we have different doctor stations where the doctors would call the patient, have better interview, examine them on beds if needed, and then dictate treatment and labs and so on that they need to get done. In the main area here, we kind of subdivided just to get our work more organized. So on my left, if you look at the 3 beds on my left, that's the critical area. So the most critical of patients who needs immediate attention and resuscitative interventions and so on, they would go on that area, right?
And this is aside from COVID-19, this is general.
This is general, right? And like I say, in here we try to keep the patients who are less likely to be COVID. So in here you would find like the people with the trauma patients, the people with heart issues and so on would mostly come in here. All the ones with the respiratory issue that could possibly be COVID, we try to see them on the extension areas outside, right? This is basically the nursing station. We have our own small mini lab as well to help to expedite our processes here in terms of lab works. We don't have all the labs being done here, but like a general blood count and so on, that is rapidly needed to determine if a patient needs blood or if a patient has to go to theater and so on, we can get that done here. Another area in the emergency room, this area we tend to call our holding area. This is where, for example, the patient is not so critical, but they need some acute intervention. So you put them on one of these beds and you treat them. They maybe spend a few hours here until they're better and then either be admitted to the ward or get discharged home. These beds are also used for examination. So it might be a patient that doesn't require a bed for the care, but you want to examine them thoroughly on one of these beds and then you can probably put them in a chair or so on. And down at the back, that area is what we call our fast track area, meaning that's if somebody comes in with, you know, you are involved in an accident or you're in a fight or so on, you got a cut or something that just needs to get stitched and then you go home, or you have an abscess that needs to get drained and then you go home, or you just have a simple fracture that needs to be cast and then you go home. So those things happen. So that's why it's fast track. You just come in, you get a small intervention done and then you go home.
We've reached the end of our walkthrough of the Accident and Emergency Department of the Georgetown Public Hospital Corporation, but our tour is not yet over. Here is that one-on-one we told you about earlier. We begin by asking Dr. Dudnot about some of the challenges faced by the staff daily in wake of COVID-19.
Because of the fact that COVID-19 is new, protocols are changing every day, both internationally, right? So that is something that as staff now you have to, every day you have to continuously read, you have to adapt to the new guidelines, you know, that are constantly changing. So from that aspect, there are challenges because, you know, adapting every day and coming to work and then next day there's something new. So obviously that can have its effects. In terms of resources, you know, I mean, we're a poor resource country. We know that we're poor resource, and this is something that it's a global pandemic, so all countries are dealing with it. So at the same time, some of our partners where, you know, we were getting supplies from, you might not get them adequately as before, and then too, because of borders that have been closed worldwide, certain things are taking longer now to come. So in terms of resources as well, you have your challenges there.
Another challenge faced by medical personnel is the fact that they are constantly and directly at risk of contracting COVID-19.
It's been a big challenge for healthcare providers, and more so us in the emergency department, because, you know, every day there's this uncertainty that every patient that walks up to you, the first thing you do is think that they're positive until proven otherwise, right? Yeah. So you got to ensure you take all the precautions. I mean, for us, for those of us who have families and who live with families that are at high risk, you know, it makes it more challenging mentally. It drains you because then when you go home, you have to think, is it possible that I might have had it because I've been in contact with a patient today and now I go home to my family. I got to take these extra precautions.
Dr. Dudnot, joined by his colleague Miss Shawnette Goodridge, ward manager at the A&E department, both pleaded with members of the public to do their part in this fight against COVID-19.
We can't do it alone. This is something that's affecting every single body. It's not just a health issue, there are a lot of economic issues along with it, psychological issues. I mean, it's an overall strain on every single personnel. And if the general public, from the smallest of persons to the highest of status can understand that no one is immune to this. And at the same time that we're in the healthcare personnel are in this very huge battle trying to keep people alive, trying to discharge people in the best of health, we need them to play their part as well and follow the measures.
The GPHC emergency room serves as the accident and emergency for the city and for even persons out of town. And we receive many referrals from all the other regional and district hospitals. So what we would have wanted, and that happened initially for a few weeks, was that we had a decrease in patient load in the emergency department. But I tell you, after a few weeks, that patient load went right back up. Because what you find, even though there was a curfew, we still had many road accidents late into the night. In the midnight on the night shift, they had victims of gunshot wounds, stab wounds, so many incidents, so many emergencies we continue to have in the pandemic. So our greatest challenge was the patient load. Of course, you know that you have to wear your mask, social distances, but if you still continue to have so many persons come into the hospital, and if you have to give them emergency care, you can't stop to say, boom, are they COVID positive or are they COVID negative? You have to give emergency care. So our first challenge was having to deal with these persons, not knowing their status, but still had to administer emergency care to them.
Dr. Dunat says the GPHC has put measures in place to keep its staff and patients safe. There is constant monitoring and screening of health workers, as well as counseling available to help them cope during this pandemic. The hospital also frequently disinfects its departments and has stepped up the use of protective equipment.
From the Georgetown Public Hospital Corporation with videographer Joanne Jordan, I'm Felicia Valenzuela. Thanks for joining us.